Hi, everybody. This is Kim Racette, and welcome back to another episode of Let's Doula This mini class. I'm really excited about today's guest speaker. Desiree Cassell is a physical therapist that specializes in women's health, women's pelvic floor health, and she owns the Balanced Momtality, which is her business, and she can do telehealth as well as home visits, which is pretty awesome. I think that's really neat. I would have loved to have somebody come to my house and work on me.
Yeah, I think so. I agree.
Right? Especially in this day and age, you don't want to be going anywhere, so having somebody come and do that for you, that would be awesome.
Yeah, don't have to worry about getting babysitters, just, show up and I'm there.
That's right. So what I'd like to talk about, up until about 3 years ago, even as a doula, I did not realize that physical therapy could be specialized into not just women's health, but women's pelvic floor health, which was such a cool concept when I first heard about it. And so I would like for you to talk a little bit about the benefits of, let's say, a pregnant mom, because sometimes women will say, oh, I have this ache or this pain, but it's just because I'm pregnant and I just have to live with it. And it makes me really sad because they don't have to live with it. There are things that can be done that could help those different aches and pains. So let's talk first about, we'll get along as far as like postpartum too, but what are some things that, some maybe problems or issues a pregnant mom might be having that she might say, oh, well, it's just because of pregnancy and it'll go away once I'm done, and I'll just have to live with it. What are some things?
So like you said, you didn't even know as a doula working with this population for up until 3 years ago. And I was just like you. I had no idea that pelvic floor, women's health, physical therapy was even a thing until I went through PT school. And it's such a bummer because I also, was one of those women who I was pregnant and I had terrible sciatic pain. I had terrible nerve pain down my leg. I had such difficulty walking, and my OB just said, oh, it's just the baby compressing a nerve. Once the baby's gone, it just comes with pregnancy and it'll go away. So I lived with it through that pregnancy, and I never fully got that resolved even after, until I got therapy for it. And it is such a bummer because we just realize that we just associate it to having the baby and all this pressure. And some of that is true. There's so many changes going on in in our bodies with growth and hormones and ligaments relaxing and skin stretching and joint shifting, that there is some aches and pains associated with that. But even with that, we can help alleviate that. But there's definitely specific things like pain in the pubic symphysis is one of them. And that's a very common pain that you get. Round ligament pain is a very common pain that, there's some stuff we can also help with that. But again, that's one of those ones, there's a little bit of pain that is associated with that stretching. But as you stretch and grow, you become so loosey-goosey with all of those hormones and everything going through our bodies that your pelvis tends to shift a little bit. So you can end up with a lot more low back pain. You can end up with a lot of pain in your tailbone, going through your glute muscles in the butt region, all the way down the leg. And any of those pains, again, my doctor wrote it off as sciatica. But mine was actually an SI joint dysfunction where my pelvis was just, shifted and got kind of locked up. And if I would have had some alignment, so we kind of work with making everything aligned and making sure your body has the strength and stability to help support that baby and support your body as everything changes and adapts. And so definitely with a lot of those common pregnancy symptoms, pubic symphysis pain, SI joint pain, believe it or not, even foot pain, because as we grow and those babies place so much weight on our feet can tend to swell and hurt and just feel like, there's knives sticking in your feet, all the weight that you're carrying around. And even just the traditional orthopedic issues of back pain from everything pulling you forward or arching your back too much and having those aches and pains through there. Also, making sure you're being safe with your mechanics as you move around, because you can stretch the abdominal muscles. And that's something that we really want to try and make sure our pregnant mamas are doing safely, so that we don't increase that gap that naturally happens in the abdominal wall. And so, yeah, any of those aches and pains that you feel even vaginally or deep, you know, a lot of women are kind of like, well, I haven't ever felt this before, but I'm pregnant and I've never been pregnant before. So is this just part of it? But if you have kind of that deep vaginal pain or some deep pelvic pain that you're just unsure of, that's definitely something that we work with the OBs and the midwives to clear and make sure it's a safe thing, that it's just a musculoskeletal issue or a nerve issue. Any tingling, numbness, all of those nervy symptoms that you can get down the legs, we can kind of cover all of that with pregnancy.
Wonderful. Now, is that something you can do virtually, or are there certain things that you would actually need to see somebody for?
Yeah. And so there's definitely, I found I'm such a big hands-on therapist. I love the hands-on aspect of PT. So it's been a mind shift for me doing the telehealth. And I've been pleasantly surprised to find that a lot of what I do is so much education and so much trying to empower the mom to have these tools in her toolbox so she can work on herself and kind of have those strategies on her own. And so, but like you said, there's definitely things that, you know, if I provide these strategies through telehealth and they're just not really getting anything, I definitely want to get my hands on them and check their alignment, check their strength. And so the approach with telehealth, I can get so much feedback back, you know, looking at mechanics through the computer, you know, checking if things are painful or not, and kind of showing them exercises and getting feedback on how those exercises feel. But there is, you know, with pregnancy, we don't tend to do internal pelvic work as often. So with pregnancy, there's a lot more things that can be done through telehealth than I originally thought. I would love to give every pregnant mom just, you know, some big massage and rub down. And that's typically what I would do in the clinic.
Right. Yeah.
But yeah, I've definitely found that there's so much, especially, I forgot to mention stress, like urinary leaking during pregnancy. Is something that I really work a lot with. And that's something that we also can talk about and work with through the computer and talk about different tools and strategies to help combat that as well. So I found that there's a lot I can do through the computer to help empower the moms and help them reach their goals, even without my hands, which was kind of like, oh man, I thought this was the magic.
Yes, right. I know. As a doula, I hear you. Like, it's been hard being, you know, now I'm allowed back in a couple of the hospitals, but, you know, doing virtually what I used to do hands-on was such a challenge.
It is. And you almost feel like you're like, oh, they're not really, you know, getting the best part. But then it really was a learning experience for me, because I was like, this isn't the best part. Like,
right.
you know, it might feel good. Yeah, exactly. It's empowering them and giving them those exercises and the tools and letting them know that it's safe to exercise while you're pregnant. You should be exercising while you're pregnant.
Yeah.
And there's these certain, you can even do high intensity exercises, you know, if it's something you've been doing and your body's handling it well. And there's so many things that I think just mentally, women, especially being pregnant, you're trying to protect that baby. So we just kind of clam up and we don't know what to do.
And everything's tight.
And it's just like, everything hurts, but I think this is how it's supposed to be. And it's just not. And so there's definitely, you know, it was really an amazing learning experience for me to realize that that is the best thing that we can provide these moms, is just that you are okay to move. It's okay to, I mean, that's just PT in a nutshell anyways, is trying to tell people it's okay to move and the safe ways to move and everything. But this population, I especially love working with, because it's just written off. You know, you're pregnant, it'll get better afterwards.
I know.
And a lot of times it doesn't, you know, and it just gets worse and worse. And I see them 10 years later, we're like, I've been peeing myself for 10 years. I just thought this was part of it.
That's what I was going to say. You know, it wasn't until you came to talk at one of our doula teas that I realized that, you know, the fact that, you know, I have to do the pee sneeze, you know, where I cross my legs, and that's, I mean, to me, that was normal. That, well, every woman I talked to, well, yeah, that's normal. You've had kids. Of course you're going to do that.
Yeah, that's life now.
but it's not, and it can be
Yep.
fixed and it can be helped. And that's just, I really want to get that out there to so many women, that there's so
Exactly.
many things that happen during pregnancy, postpartum, that they don't have to live with, that they can
Yep.
get fixed, and it can be helped.
Exactly. It's such a common thing, but that doesn't make it normal. And
Right.
that's what we need to realize, is that, there's all of these things, even not pregnancy related, that they're trying to normalize urinary incontinence, the making pads look pretty, making
Right.
the adult diapers look pretty. And it's like, look, no shame. It's got flowers on it. No, there's no shame in asking for help. Get that peeing yourself out of the scenario. It does not need to
Right.
be part of your life.
And
So I
and
think
not even necessarily doing surgery to prevent, to help it, but just with
exactly.
physical therapy. So
Yep. Yep.
yeah, awesome.
Yeah.
Awesome. So is there maybe one simple exercise that you give out more often than not to pregnant moms, for something, for that the normal pregnancy aches and pains, that you can show us or tell us how to do?
Yeah. So, let's see if I can narrow it down to, I think that the main thing that I definitely was, again, a big learning experience for me, because I didn't realize how powerful it was. And so it's something I talk about with every single one of my patients, and that's breathing. And so you kind of just like, well, breathing, I know how to breathe. Why would I go see somebody if I know how to breathe already?
Right.
And it is kind of funny to realize how so many people don't know how to breathe correctly.
Right.
And it all comes down to using our core as the system that it is, and making that core work as a unit, so that all of the pieces are talking to each other. And the whole purpose of the core is to maintain that core pressure. And so we're preventing things like leaking, prolapse of our pelvic organs, hernias, hemorrhoids, prolapsed discs, all of those things that are a sign of pressure placed where it's not supposed to.
Right.
And so breathing is one of the biggest things that have helped, kind of that missing piece for me, to kind of help correlate that whole body system, so that when you're doing an exercise, you're getting the biggest bang for your buck, and you're saving yourself from injury, and you're also making it a core workout, which everybody wants, that nice
Sure.
toned core.
Yeah.
And so breathing is definitely something that I work with all of my patients, and it helps to associate, especially for the pregnant mom, the belly's stretching and growing, those abdominal muscles are separating, you're getting that normal gap that we talked about with the diastasis recti as they separate. And so it gets harder and harder to feel what that core contraction should feel like.
Right.
And so the earlier you kind of get a sense of what that feels like, you can continue it all the way through 40 weeks if you know what you're doing, essentially.
Yeah.
And so, because I'm not saying go contract your abdominal muscles all day long, you're pregnant. No. But you do want to make sure that you know what that feels like to engage that deep abdominal muscle, because I should also specify, we're not talking about your six pack. You're not talking about that superficial
Right.
muscle of abs.
Mhm.
We're talking about that really deep transverse abdominis muscle that works kind of more like a corset. And that's just the front part of the abdomen. That muscle does wrap around, but you've got some small back muscles as part of the core. The diaphragm up top is the roof of the core, and then your pelvic floor is that foundation.
Yeah.
And for me, that part's the most important, because I just feel like, it's holding everything up all day long, and
Right.
everything else gets attention except for those muscles. And it's also got gravity weighing on it. So it just has so much working against it that we need to give you some tools to help build that back up.
Right.
But so getting all of those pieces, the top, the bottom, the back, the front, to all work together and to manage that system equally is kind of, I think, the game changer for everybody. Just because you can apply that to every exercise you do, every functional exercise you do, bending over, picking up the baby, picking up a car seat, carrying groceries, there's just endless application functionally for this. And it does prevent so many injuries. That I would say breathing is probably the biggest one. And so it is a specific type of breath. I call it a core breath or piston breath. And a piece of it is called the diaphragmatic breath, that I think a lot of people are a little more familiar with that term, especially if you've done yoga or meditation. They refer to that diaphragmatic belly breath. And so I think, I change it a little bit terminology wise more towards the core or piston breath, because I don't want to just focus on the belly expanding. We want to really bring our awareness down to the pelvic floor, because most of us have forgotten about that part of our body. There's so much taboo around that part of our body that we don't even really think about it, let alone really know what it feels like to move that muscle and groups of muscles. There's a lot of muscles involved in the pelvic floor, and it's really powerful, especially as you go into delivery, knowing how to relax those muscles.
Right.
And so that's where this breath is amazing for pregnant moms, because this is the breath you should be doing when you're delivering the baby. It's having that control of turning on and off the pelvic floor that is just such a game changer.
Right.
Because a lot of first moms, especially, you don't know how to push. You're recruiting every single muscle you can, and you're just squeezing away.
Yeah.
And your pelvic floor is probably tightening, and it's not going to let anything through. And
Yeah.
you might end up with a longer pushing phase, a vacuum suctioning, tearing, God forbid a C-section, something that makes it so that you're in labor a lot longer and having to deal with more interventions than you'd like.
Right.
So that breath, you're really trying to inhale, and you're trying to feel the belly expand and rise. But I also really want my patients to feel their pelvic floor like blossoms in between their legs. So a good strategy for that, I'm sitting on one now, is to sit on a ball. So when you do it on a ball, you can kind of feel the pressure change against the ball, where you can get a little bit of feedback.
Yeah.
And you can really sense, is my pelvic floor expanding a little bit? You can also use a handheld mirror and kind of put it between your legs and watch and see, as I inhale and my belly expands, do I also see my perineal region, move towards the mirror and see that expansion happen? And really feeling the belly, not just at the belly button, but all the way around that core system, and your sides expanding. You want to just feel that air coming down. So yeah, I think that breath in and of itself is just so powerful. And the other end of that breath is obviously you exhale and your pelvic floor kind of recoils back up. But especially for my pregnant moms, we just really focus on relaxing that pelvic floor, turning off that pelvic floor, being able to feel it lengthen and open up, so that you can tune into that same feeling when you're in the midst of it all. You're trying to just like, okay, wait, what was that thing I did? Because it all does come down to that motor planning and motor learning, and trying to get your brain to know that pattern in a non-stressful state.
About it. Right.
Yep,
yes.
Exactly.
Yes.
Yeah. Oh no, my computer might die.
Oh no.
Do you mind if I go grab my charger really quick? I had so much battery and it just disappeared.
No, I'm going to pause. All right, starting it up again.
Yeah, sorry about that.
No, that's fine. I'm glad you saw that. So, I love that. I love that breath work. It really is super important in labor, to be able to do that, but definitely for the pushing part, the birthing part of giving birth, rather than, like you said, that purple faced pushing that you're using your shoulders and your neck and like all these muscles that you don't need to be using. And it is so different when I see a mama pushing from that aspect as opposed to the other. The one you see in the movie.
Exactly. And it's just so, I mean, I have had both experiences, my pregnancy and my delivery before I knew all of this, and my pregnancies and deliveries after, and they're just opposite sides of the coin, you know, and it's just
Yeah.
something that I can't say it's going to be that way for every mom who learns this technique. But for me, especially, it was just so eye-opening because with my first, it was a very traditional lying on your back, you're pushing, you're straining, oh, I don't know how to do this. And
Yes.
even, you know, in the moment, it felt like hours, but it was 9 minutes I was pushing, which I guess for a new mom is, you know, pretty good,
Okay.
but it felt
Yeah.
like forever. It
Yeah.
was like the longest time ever. And I
Yeah.
was like in that, you know, like I'm going to pass out and die because I was just like over hyperventilating and squeezing. And I had like this out of body experience of lack of oxygen, probably more than anything, where,
Yeah.
you know, the baby got placed on my chest and I was just kind of like way out of it.
Yeah.
And then with my second one, knowing everything I did, I was like, you know what, just with the way pain is, you know, pain makes you tense up. And then if you have tense muscles, your body feels more pain. So you tense
Right.
up more. It's just
Right.
this vicious cycle
Vicious
of
cycle.
pain and strain, and
Yeah.
everything gets worse. And so I was like, I know better than this. I need to go in with this mindset of just trying to be a loosey goosey noodle. And I was kind of laughing at myself because I was like, you know how painful this is. Like, that's not going to happen. And in the moment, you know, it was something that I had to definitely, you know, my husband was on board with me. He was a great supporter to remind me of that breath and to remind me, you know, to relax. I didn't even squeeze his hand because I knew that anything tensing up
I
was going to cause
yes.
like that global tension.
Mm-hmm.
And so my husband's only job through that pregnant delivery was to just hold my head as I just like went limp and fell into his hands while I sat on the ball to just try and breathe through it. And it was, you know, it was amazing. I, you know, knowing, you know, different birthing positions and stuff, I refused to lay on my back through that labor. I stood up and I pushed that baby out in 1 minute. And that was just, you know, I say gravity did all the work because I just, you
Right.
know, tried to shut everything off and I fell on my husband and I just listened to my body and I just let my body do its thing. And that's what I did with my third one too. And yeah, it was similar. I stood up and pushed him out within a minute. And it was just afterwards, I was with it. You know, I was like, oh, the baby's here. And I wasn't
Right.
like,
Yeah.
oh, I can't even stand.
Yeah. Where
So,
you don't even, you're kind of out of your body experience sort of.
yep.
Yes. Yeah. No,
Yeah. Yeah.
that's awesome.
And it was just, you know, even during pregnancy, that breath is so powerful for pain relief. Because if you start to have, especially towards the end when you're getting, you know, bigger, baby's getting bigger, you have all of that pressure on your pelvic floor muscles. If you didn't have a strong pelvic floor before, chances are things are going to start kind of spasming up to support everything, because
Right.
that's your body's one job, is to keep that baby safe and keep everything in there until it's time. So everything is going to tighten and do everything it can to make that job happen. And so with those tight trigger points, muscle spasms, it's a lot of trying to open those muscles again, relax those muscles, take the weight off those muscles, you know, lie down, lie on your side, do some deep breath work. And you can feel, if you can feel that relaxation, it can just take the pain away within just a few breaths. So it is a very, very powerful technique.
I love it. I love it. That's fantastic. Desiree, that is so life-changing for
Yes,
mamas, and that's
I agree.
fantastic.
I agree.
So I know we talked a little bit about one of the postpartum issues that you can deal with, which is the leaky
Yeah.
urine sort of things. But are there other things that you find you have to work with mamas a lot after pregnancy, after birth?
I already got it. Yeah, so I think when it comes to postpartum, there is also that kind of, oh, you just had a baby, you'll
Right.
leak for a little bit, it'll go away. And in some cases that is, you know, totally the scenario, you know, oh, I leaked for a couple weeks, but it's gone now. And that's great. But yeah, there's the urinary leaking pelvic pain. So after that baby, any trauma, any scarring that occurred from having to get stitched up, or if you got an episiotomy or a C-section, any of that scar tissue can cause a lot of pain. So we do a lot of scar work, and doing a lot of attention to that kind of connection of the core to try and turn things on very gently, because let's face it, even though you're sent home a day or two after the baby, you're not laying around recovering in bed for a week or two. I mean, hopefully for the first week, you are mostly laying around and
Right. Yes.
relaxing,
Yes.
but that's just, especially if you have other kids at home, you know, chances are you're up and down, you're moving around, you're walking, you're bending over, and you want your core muscles to help you and be turned on during those moments, because especially when they're turned off, like they typically do after having a baby, because it's a trauma for the body. The body senses it as this huge traumatic thing just happened. We got to protect the body, so let's shut everything off. It's kind of its way of helping protect and recover. But that can lead to other issues, especially if you bend down to help pick up the baby or pick up a car seat and you don't have that core strength. You pull your back and your back's now aching and hurting. And so
Right.
trying to just find those exercises that you can do almost day 1, day 2 after having the baby, that are just as gentle as the physical stuff you're already doing. And then trying to make sure we're easing that mom into exercise if that's something that they want to do. You know, if they're wanting to get back to the gym, get back to running, CrossFit, or whatever they're into, I think it's really important to have that kind of guided progression instead of just the typical 6-week, you're good to go, everything's healed, awesome
Sure.
job.
They jump into it and they're like, well, yeah.
Yeah. Yep. So that's typically what I think it does need to be a standard of care at this point for moms, because even if it's just a 1 visit check from a pelvic floor PT, because, you know, midwives and OBs, they have so many bigger things to worry about. You know, it's more of a life or death situation for them. They want to make sure your tissues are healed. They want to make sure all the organs are, you know, nothing's bleeding anymore. Your body is, you know, good to go and you will survive. That is their job. And that's a huge job, but they're not looking at the strength of your muscles, the coordination of your muscles, the trigger points in your muscles, the strength of your core. You know, are you going to cause yourself injury because you are really lacking, you know, these key pieces? And that's just not, they have so many other things to worry about. So it's not being checked. And I think that it's something that all moms should be aware of, at least, going into exercise, especially if they are active. Because it tends to be, you know, you have the baby and the mom feels pretty good, even after, you know, even maybe 3 or 4 weeks, they're like, I'm ready to do something. And maybe they're fine because they're easing into it, but then doctor clears them to run and lift heavy weights, and all of a sudden the leaking starts to happen. They might have heaviness, pelvic heaviness from pelvic organ prolapse, because the weight of the baby and everything and the weakness is actually pulling those organs out of the body. And that's something we can help with that support of the pelvic floor muscles and that maintaining the core pressure. I'm trying to think about, so diastasis recti, we kind of touched on that one. That is another huge one. Yeah. So especially postpartum, you know, during pregnancy, again, that is a normal separation that occurs. And it's more postpartum where we want to be really careful, because there's a normal period where you can still have it and it's healing. But that tissue isn't a muscle. It's not going to contract up as tight as it was before. It's more of that kind of ligament tendon type of tissue that only has so much ability to tighten back up. And so if there was a lot of extra stress or strain, or maybe you had twins or triplets, you know, and there was just so much stretch done there, then there's that we call it vaulting, or kind of pitching in the abdomen, that can occur when you sit up, or doing specific exercises. Or I noticed mine when I was washing my hair in the shower, leaning back, and it kind of looks like your abdomen is, you know, pitching a tent. It's coning. And so, you know, I would say about, you know, that healthy period of 6 to 8 weeks after having a baby, when everything's healed, if you still have that is something that we want to try and work on. And I would definitely advise having it be an observed progression, because if you go in too quickly, you can cause more of a permanent long-term damage, which unfortunately is what I did after my first one. Went to a Pilates class thinking, yes, I'm going to get my core back after this baby. And I did so many sit-ups and so many V-sits and these things that cause it to get even worse because I had no idea. And so I still have it to some extent. And there's a lot of research and studies coming out now that the size of the space isn't really what matters. You need to be able to create tension through that ligament. So if you're pressing on it and it's really soft and squishy and you're thinking you're contracting, then you're definitely going to need a little bit more help. Because you can still have a really strong core and have that space. So it's not all about the space. It's just more about having that ability to contract and control and maintain that pressure through the system.
Fantastic. All right. I keep wanting to talk. There's one more thing though that I do want to ask. Would it be advisable for a mom who's thinking about becoming pregnant? Are there things that you could do to help her before she gets pregnant? Like, let's say she had maybe scar tissue somewhere from an appendectomy or something like that. Is it advisable to maybe see you before she gets pregnant to maybe clear up any issues prior to getting pregnant?
I would definitely think that it would be beneficial if getting pregnant is something that, you know, especially you're trying to do, and you know you have, I mean, a lot of women have a history of different pelvic surgeries, abdominal surgeries,
Right.
and that scar tissue can wreak havoc on the system just because it is essentially adhering everything that's stuck to that tissue.
Right.
And so if it can even help with getting pregnant, if you're having issues getting pregnant, a lot of it can be scar tissue related.
Right.
And making sure that the organs are sitting in the right place, because scar tissue can kind of tug and pull on the whole system. And so I think scar tissue is definitely one of the things that would be worth working on before getting pregnant, if you know you're getting pregnant. I also think the breath work would be really an amazing thing. If I had known that, you know, before my very first one, it would have been a game changer.
Yeah.
Just in that core strength of that initial, you know, first few weeks, first few months, you don't even have much weight on the system, but you have all those hormones running through your system. So everything's already loosey goosey, and you might not have that strength there already to help that. So you might be getting symptoms and, you know, leg pains, those nerve pains, back pains, pelvic pains, long before you even have very much weight from the baby. And so that might even be concerning, you know, I'm not very pregnant. Why am I having all these pains already?
Right.
And so that is definitely something, if you already have that core strength, it's like preparing for, you know, a surgery. The stronger you are going into a surgery, the stronger you are coming out of that surgery. So similar with pregnancy, you know, the stronger you are going in, the stronger you're going to be coming out of it.
And I liked how you were saying that if you have some tightness on one side, it causes things to be like lopsided
Mm-hmm.
off. I found that some women whose babies aren't lined up really well to come down or maybe even breach, sometimes those women have had either past pelvic uh, surgeries or maybe appendectomies and stuff like that, where the baby just doesn't have room to line up perfectly because one side's really tight and
Yes.
it's hard for the baby to get lined up correctly.
Yes. Yeah. And I would say also along that same lines, your sacral mobility. So if your pelvis is one that maybe you had, you know, a tailbone injury, or, you know, that sacral injury or pelvic injury or a hip fracture, or something that caused your pelvis to kind of lock up or get out of alignment. If you're out of alignment, that, you know, it can be such a minor abnormality that you might not have any symptoms from it. But if your sacrum is kind of stuck, when you're delivering, that sacrum is supposed to open up like a door. Yeah. And if and you know, that's also why lying on your back isn't ideal, as you know, because you don't have room for that sacrum to open up. And so another thing is just empowering women to know the other positions that they can deliver in. But if, you know, if that sacrum is pinned down from scar tissue, or it's, you know, kind of stuck from the pressure of the bones on each side from a past fall,
Right.
or broken tailbone, then you're going to have a lot of issues pushing that baby out, because that really does create about 30, you know, it has like a 30-degree swing of opening during that pushing phase, that if that can't happen, then there are, you know, a lot of other issues that can happen after that.
Exactly. Oh, Desiree, I could sit and visit with you all day, but I probably should cut this off, especially since you have a baby that might be waking up soon.
Yes, yes,
So.
I hear him in the background trying to give dad one for his money. But I love chatting with you, and yeah, I could talk about this all day long. So if you're ever up for anything in the future, I'm always here.
Absolutely, and
really
I'm going
enjoy
to
thinking of
link.
me.
I'm going to link all your information on the video so people can get in touch with you.
Yeah.
And but I really appreciate you, Desiree, and I appreciate you people for coming and watching our videos, and I hope you guys have a wonderful day.
Yeah, thank you so much.
Thank you.